We will talk about low back pain and 5 most common causes of low back pain and their treatment. First and most common cause of low back pain is muscle and ligament strains. What kind of this pain is? It's localized pain and does not radiate. Person has low back pain, it does not radiate, it means does not spread to leg, for example, does not spread to upper part. It's localized aching pain. And if you ask person about this pain, he will say that he overstretched muscle. For example, he was lifting something, or he was in poor posture for prolonged time. For example, sitting at the car, and when he out from car, he felt pain on his back. It is because of muscle and ligament strain. Why it happens? It's overstretching of muscles or ligaments, and sometimes torn of ligaments, and complete torn is rare but possible, but it's rare cases. And most common cause of such muscle strain and pain is improper lifting something or poor posture for prolonged time. Now let's say about management, what we should do. First and most important is rest. You should rest at least around 2 days. After 2 days you can start activities, but this rest does not mean complete passive position. Of course, you should do some gentle movements, of course. Second part of treatment is ice or heat compresses. It helps inflammation, and it helps if there is wart of skin and inflammation. If there is swelling, then ice or heat compresses helps. About medications, acetaminophen is most commonly used for pain management, ibuprofen also, and naproxen also. They are non-steroidal anti-inflammatory drugs, ibuprofen and naproxen. And topical creams also effective, especially diclofenac. Diclofenac is topically applied to the back, and it's effective, and it has less side effects. That's why it is used, because ibuprofen and naproxen, they have systemic side effects, and for example they can irritate gastric, or they can increase risk of bleeding from gastrointestinal tract, and topical diclofenac has less side effects. Also, capsaicin cream is effective. Capsaicin is content of chili peppers, and capsaicin decreases substance P, which is important for pain conduction in the nerves. But if you're using capsaicin, you should remember that you should use it for several days for important effect, because it has no very instant effect. For instant effect, topical diclofenac is much effective. Lidocaine also is effective, lidocaine patches or creams, but they have very limited action, very short-term action. And to prevent future strains, core strengthening exercises are important, such as push-ups or plank also is core strengthening exercises, which is very important. Now let's say about second most common cause of low back pain is herniated disc or disc bulging. What means? We have here vertebrae and we have intervertebral disc. When intervertebral disc is repositioned, and when it changes position, or when it's weakened, it can protrude from its place and press the nerves around, and it causes inflammation, it causes pain. You can see here also this is protrusion of soft gel-like substance which is inside disc normally, and it can bulge from here and press nerves and cause pain and cause symptoms. It means herniated disc. And what are the symptoms of herniated disc? Low back pain, but sometimes low back pain cannot be presented. It's also possible, but most important part is that pain radiates to the leg. Pain radiates from back to the leg. It's very important symptom, especially if it radiates lower than knee. It's almost always is herniated disc or disc bulging. If pain radiates from back to the leg, it is herniated disc, and this symptom and this syndrome, this condition is called sciatica. When pain radiates to the leg, it is called sciatica. It's important. And person can have tingling sensation in the feet, for example, below the knee or in the leg, and tingling or numbness or pain, and this pain and these symptoms follow sciatic nerve area. It's not very localized. So if person says that I have tingling only one toe, it's usually not sciatica. It's usually not herniated disc. But when person has herniated disc, symptoms are more complex. Symptoms follow the pathway of sciatic nerve, and during sneezing, during coughing, or during movement, symptoms are increased, pain increase, and it's important that even person is sitting, symptom can be worse, and it's different from muscle strain and ligament strain. When person rests, he feels better, and when person is very active, as this case, pain increases. And in case of herniated disc, even person is sitting and resting, he still can have pain, and this pain sometimes is severe. For diagnosis, MRI and computed tomography is used. You can see it's MRI picture, and you can see this bulged and herniated disc here, which press surrounding tissue and causes pain. What is the treatment? Treatment is core strengthening exercise, manual therapy, massage, and manipulation. They are effective. They have some degree of effectiveness. Ibuprofen, acetaminophen, and naproxen for pain management, and muscle relaxants sometimes are used. And sometimes steroid injections are also required in case of severe inflammation and severe pain, and low dose of antidepressants such as amitriptyline, which is tricyclic antidepressant, is used in case of chronic back pain due to herniated disc. We should say that most cases of herniated disc is managed without surgery. So surgery sometimes is required, but most cases, more than 90% of cases, will be managed effectively by non-surgery methods and conservative methods. Third most common cause of low back pain is arthritis. When we say arthritis, we mean inflammation of joints, and under the arthritis we usually mean osteoarthritis and rheumatoid arthritis. These two are most common. Of course, there are lots of types of other arthritis, but we usually mean osteoarthritis and rheumatoid arthritis because most cases are on these two conditions. And previously, arthritis also was named as osteochondrosis, but osteochondrosis is not modern term, because now osteochondrosis is usually used when there is growth plate blood supply dysfunction, so it's not used as a term to denote arthritis generally. And what kind of pain person has at this case? Pain is after inactivity or morning pain. Person will say that since I woke up, I have pain, I have stiffness of joints, but after some period of time, after some movements, I feel better. So physical activity, gentle physical activity improves condition, and rest worse condition. It's arthritis. Such pain are because of arthritis. this pain usually is not very severe, but it's possible to be severe, but most cases not very severe. And why it happens? It happens because we have here joints, and we have here protective layer of bone, and this protective layer, which is cartilage, is wear and tear over time, and bones are interact together at this case, and it causes pain, it causes inflammation. So this process usually is associated with age. Now, what is the treatment? Most important part of treatment is weight loss and exercise. It's very important. Ibuprofen, naproxen, and acetaminophen also used, and also topical applications such as diclofenac or capsaicin can be used, but usually it can be, especially if there is early stages, it can be managed by weight loss and regular physical activity. Chondroitin, glucosamine are supplements which are used to help cartilage. Also turmeric or curcumin is used, which is also anti-inflammatory, and it can help also for cartilage. And in severe cases, there is joint replacement therapy is required. And first most common cause of low back pain is scoliosis. Scoliosis is the form of spine. You can see here also it's X-ray image, and visually you can see that there is a deformity of spine and uneven shoulders and or uneven hips. You can see that even hips are different. It is scoliosis. Scoliosis usually congenital, but it can develop during adolescence also. You can see as curvature, and scoliosis can be asymptomatic. In many cases it's asymptomatic and people live without any pain, but the symptoms can be since childhood, and symptoms can worsen over time into adulthood also. What is the treatment? Scoliosis treatment is observation at first phase when there is no important symptom, bracing in adolescence to correct this scoliosis and prevent further curvature and further deformation, and exercises, physical therapy also important. And fifth most common cause is osteoporosis. Osteoporosis can cause very severe, very painful low back pain due to spinal fracture. What means osteoporosis? Osteoporosis means bones are weakened because they lost mineralization, they lost strength, and this condition is more common after 70 in older ages, and it importantly increase risk of fracture. And if these fractures happen into spine, it's very painful and it's very important pain. Osteoporosis has no symptoms at first stages, but if it has symptoms, it's very severe pain and sudden pain. How can we prevent osteoporosis? It's adequate vitamin D and calcium intake. Also, physical exercise is important, especially weight-bearing exercise to strengthen muscles and bones is very important, because most common causes of osteoporosis is aging, hormonal change, low calcium intake, and sedentary lifestyle. So bisphosphonate also important medication which can prevent fractures and improve bone strength, which is used, and calcium and vitamin D is very important, also magnesium supplements. That's all I wanted to say. Thank you for your interest, thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.